depression in adolescence is more common than people believe. Due to developmental changes in the teenage years, it can be more common among adolescents than adults. Most young people will experience challenges related to their changing bodies, new social relationships, and educational challenges. However, young people at risk for adolescent depression may have a more challenging time coping with these changes and easily become isolated. Per the National Survey of Children's Health, over 3.8 million adolescents aged 12 to 17 in the United States had at least one major depressive episode. This proportion was 15.7% of the population aged 12 to 17 in the United States. The incidence of depressive episodes was greater among adolescent females 23.0% than males 8.8%. Many factors can contribute to the development of depression in adolescence, such as biological changes, family history, early sexual activity, social environment, bullying, physical or sexual abuse, unemployment or job loss. Warning signs of adolescent depression. If you are concerned that your teen may be suffering from adolescent depression, look for the following warning signs: change in eating habits, social withdrawal, sleeping habits, school performance, change in appearance. How to diagnose depression in adolescence. If you suspect that your teen is suffering from depression, it is important to consult a doctor as soon as possible. Your physician can perform several different tests and examinations to determine whether or not your child is suffering from adolescent depression. An adolescent may need to meet with a psychiatrist for additional evaluation in some instances. The Diagnostic and Statistical Manual of Mental Disorders is the standard reference mental health providers use to diagnose depressive disorders. Common tests for identifying depression in adolescents include physical exam. A doctor may perform a physical exam to determine if any medical conditions could be causing your teen's depressive symptoms. Psychiatric evaluation. This involves meeting with a psychiatrist or psychologist who can provide more information on the severity of the depressive symptoms. A psychiatrist can provide additional evaluation for your teen. They will likely ask about the following: your teen's medical history, your teen's mood and feelings, behaviors, including those that concern you, your family's mental health history, the environment at home or school, whether any drugs or medications may be contributing to your child's symptoms, your teen's relationships with family and friends, whether your teen is involved in high-risk behaviors or has been sexually abused. Psychological evaluation. A mental health professional may perform personality testing to understand how depression impacts your teen. Personality tests can help a mental health professional determine if the teen has a pessimistic outlook, feels guilty or worthless, and lacks concentration. Treating depression in adolescence. If your teen has been diagnosed with adolescent depression, there are several ways to be treated. The kind of treatment that will be recommended will depend on the severity of your teen's condition. Medication. Selective serotonin reuptake inhibitors and tricyclic antidepressants are the most commonly recommended medications for treating adolescent depression. Cognitive behavioral therapy. Cognitive behavioral therapy, or CBT, helps people learn how to identify and correct negative thought patterns, can also help alleviate depressive symptoms in teens. Stress management. It is important to teach your teen stress management techniques that they can use throughout their life. Stress has been shown to contribute to depression, so your teen must learn healthy ways of managing the stress in their life. Psychoeducation group sessions. A psychoeducation group session is beneficial for teens because it allows them to interact with other adolescents who are experiencing depression. Depression in adolescence is a serious condition that must be diagnosed and treated by a medical professional. If you notice any changes in your teen's mood, it is important to consult with a mental health provider so that they could be evaluated for depression. Enhance Health Group helps adolescents fight depression for a better life. At Enhance Health Group, we specialize in providing quality mental health services to help adolescents with depression lead healthy, productive lives. If you or a loved one is dealing with major depressive disorder, call us for a consultation in Orange County today. Thanks for watching our video. For more information, please visit our website enhancehealthgroup.com.